Taking your Prilosec or Nexium for your heartburn could be blocking your nutrient absorption while you're on your GLP-1 meds, or that restricting calories continuously rather than cycling them leads to rapid metabolic crash.
Did you know that one of the most commonly prescribed blood pressure medications can land someone in the hospital when combined with Ozempic? And not because of some rare allergic reaction, but because of something as simple as dehydration. GLP-1 and GIP medications like Ozempic, Wegovy, Mounjaro, and Zepbound are incredibly powerful tools for weight loss and metabolic health, but mixing them with the wrong foods, supplements, or medications can lead to serious consequences. Today's video covers 20 things that should never be combined with these medications and explains exactly why at a pharmacologic level. As always, this content is for medical education purposes only. It does not replace personalized care from a medical provider. Stick around until the end and let's get into it. Number 20. Excessive fiber supplements. GLP-1 medications significantly slow gastric emptying. Adding large doses of bulk-forming fiber, like psyllium, to an already sluggish GI tract creates conditions for bezoars, which are compacted masses that can obstruct the stomach. A 2023 study in BJS Open found about 17% of GLP-1 patients had gastric bezoars before surgery versus 0% of patients not on these drugs. The fix is simple: increase fiber gradually, drink plenty of water, and prefer whole food fiber over concentrated supplements. Number 19. Laxatives, especially stimulant types. Up to 30% of GLP-1 patients experience constipation, making laxative use very common, but GLP-1s already cause fluid loss through nausea and vomiting. Adding stimulant laxatives like Senna compounds that further dehydration risks electrolyte imbalances and acute kidney injury, which the FDA specifically warns about in the Ozempic label. Stool softeners like Docusate are the safer first option. Chronic stimulant laxative use should be avoided. Number 18. Artificial sweeteners and sugar alcohols. Sugar alcohols like erythritol and sorbitol are poorly absorbed and act as osmotic agents. Combined with delayed gastric emptying, they ferment in the gut, causing bloating, cramping, and diarrhea. Now, some claim artificial sweeteners like sucralose specifically worsen GLP-1 side effects through microbiome disruption, but clinical evidence on that specific interaction remains limited. The practical advice is straightforward. Plain water or sparkling water beats diet sodas, especially in the first few months. Number 17. Cannabis and marijuana. THC activates CB1 receptors, which stimulate appetite and suppress the body's natural GLP-1 secretion. A study in the journal Diabetes confirmed that CB1 and GLP-1 receptors have reciprocal interactions, essentially working in opposite directions. So, THC pulls the appetite lever one way while the medication pulls it the other. Both also independently slow gut motility, increasing bloating and nausea risk. Cannabis use may partially undermine weight loss benefits. Number 16. Caffeine during dose escalation. There is no established pharmacological drug interaction between caffeine and GLP-1 medications. However, many patients report worsened nausea, heartburn, and sulfur burps during the first 4 to 8 weeks or after dose increases. Caffeine stimulates gastric acid, and when the stomach empties slowly, that extra acid lingers. It's not dangerous, but it can be uncomfortable. Moderating caffeine during dose escalation is smart comfort advice. Number 15. NSAIDs like ibuprofen and naproxen. NSAIDs reduce protective prostaglandins in the stomach lining, while GLP-1 medications keep acid sitting in the stomach longer. But the bigger concern is kidneys. GLP-1 induced dehydration combined with NSAIDs' reduction of renal blood flow creates a compounding acute kidney injury risk. According to drugs.com, semaglutide plus ibuprofen is classified as a moderate interaction. Using acetaminophen instead is a much safer approach on GLP-1 therapy. Number 14. Herbal supplements, especially berberine. Berberine has been marketed as nature's Ozempic, and research confirms it actually stimulates the body's own GLP-1 secretion through bitter taste receptors. A 2015 study in biochemical pharmacology documented this. Combining berberine with a GLP-1 agonist creates multi-layered glucose-lowering effects with additive hypoglycemia risks, especially alongside metformin or sulfonylureas. Berberine also inhibits several liver enzymes. Disclose every supplement to a prescriber. If this is helpful so far, take a second to hit the like button and drop a comment below about the biggest challenge or win on a GLP-1 journey. Every comment gets read and helps shape future videos. Number 13. High-fat meals and fast food. Fatty foods trigger the hormone cholecystokinin, or CCK, which contracts the gallbladder and slows gastric emptying even further on top of what GLP-1s already do. The result can be severe nausea, reflux, and vomiting. Cleveland Clinic dietary guidance recommends GLP-1 patients prioritize lean proteins, complex carbs, and healthy fats instead of large greasy meals. Number 12, medications that slow gut motility. Opioids, anticholinergics, antihistamines, and tricyclic antidepressants all slow gut motility independentally. Stack that with GLP-1 medications and the result can be extreme gastroparesis, where food just sits in the stomach for hours. The American College of Gastroenterology classifies both opioids and GLP-1 agonists as causes of iatrogenic gastroparesis. Anyone with existing gastroparesis or severe reflux should be especially cautious. Number 11, anti-nausea medications masking warning signs. GLP-1 medications carry FDA warnings for pancreatitis and bowel obstruction. The early symptoms of both severe nausea, vomiting, and abdominal pain look almost identical to common GLP-1 side effects. Antiemetics, like ondansetron, can suppress the very symptoms that would signal a medical emergency. Viewers should seek emergency care if nausea suddenly becomes severe, if abdominal pain radiates to the back, or if anti-nausea medication stops working when it previously helped. Number 10, extreme calorie restriction. GLP-1 medications already reduce intake by 20 to 40%. Adding severe caloric restriction on top increases gallstone risk, which is already 37% higher on GLP-1s. According to JAMA Internal Medicine, accelerates muscle wasting since up to 40% of weight lost can be lean mass and worsens nutritional deficiencies. Guidelines recommend a minimum of 1,200 calories daily for women and 1,500 for men, with at least 1 gram of protein per kilogram of body weight. Number 9, stacking GLP-1 agonists together. Some patients try combining semaglutide with tirzepatide when one stops working. Mounjaro's product monograph explicitly states it should not be used with other GLP-1 agonists. StatPearls confirms this is contraindicated. Excessive receptor stimulation causes prolonged insulin release, severe gastroparesis, and heightened pancreatitis risk with zero demonstrated benefit. One GLP-1 agonist at a time. Switching agents should only happen under provider guidance. Number 8, SSRIs and serotonin medications. SSRIs like sertraline commonly cause nausea and decreased appetite. Combined with GLP-1 medications, those effects can stack significantly. Regarding the depression concern, in 2025, the FDA completed a comprehensive review and found no increased risk of suicidal behavior with GLP-1 medications, actually requesting removal of that warning from several labels. A large NIH study found semaglutide was associated with a 49 to 73% lower risk of suicidal ideation. Still, anyone noticing mood changes should speak with their provider promptly. Number 7, diuretics. Diuretics like Lasix and hydrochlorothiazide remove water from the body on purpose. GLP-1 side effects also increase fluid loss. Together, it's a recipe for electrolyte imbalance or acute kidney injury. The FDA has documented post-marketing reports of kidney injury requiring hemodialysis in dehydrated GLP-1 patients. A pharmacokinetic study found oral semaglutide increased furosemide exposure by 28%. Hydration and periodic kidney function tests are essential. Number 6, ACE inhibitors and ARBs. This is one of the most important interactions on this list and doesn't get enough attention. ACE inhibitors like lisinopril and ARBs like losartan block the system kidneys rely on during dehydration. When GLP-1 nausea and vomiting cause volume loss, patients on these medications lose a critical safety mechanism, leading to acute kidney injury or dangerously low blood pressure. A BMJ case reports publication documented a patient on lisinopril who required cardiac resuscitation after starting a GLP-1 medication with dehydration as the trigger. Sick day rules matter. Hold these medications during severe vomiting and contact a doctor immediately. Number 5, appetite suppressants like phentermine. Phentermine raises heart rate and blood pressure while suppressing appetite. GLP-1 medications suppress appetite differently and also modestly increase heart rate. The Wegovy label states directly that safety and effectiveness in combination with other weight loss products have not been established. No randomized controlled trials on phentermine plus semaglutide exist. This combination lacks safety data. Number 4, metformin. with a specific warning. Metformin plus GLP-1 is safe for most patients, but here's the danger pathway. GLP-1-induced vomiting causes dehydration, which triggers kidney injury, which impairs metformin clearance, causing it to accumulate and potentially triggering lactic acidosis, a rare condition with about 50% mortality. A 2018 BMJ case report documented exactly this in a patient who started liraglutide. The critical rule: if severe vomiting or diarrhea lasts more than 24 hours, temporarily stop metformin and contact a provider. Number 3, oral medications with narrow therapeutic windows. Delayed gastric emptying changes how quickly oral pills are absorbed. For levothyroxine, one study found semaglutide increased total T4 exposure by 33%. And case reports document rising TSH levels after starting Ozempic. But here's the critical distinction that rarely gets mentioned. For oral birth control combined with tirzepatide, specifically Mounjaro or Zepbound, absorption of ethinyl estradiol drops 59% and norgestimate drops 66%. The Mounjaro label explicitly advises switching to non-oral contraception or adding a barrier method for 4 weeks after starting or increasing the dose. Semaglutide, meaning Ozempic or Wegovy, did not show the same effect. That distinction matters. Number 2, insulin and sulfonylureas. Sulfonylureas force the pancreas to secrete insulin regardless of blood sugar levels. GLP-1 medications add glucose-dependent insulin secretion on top. Together, the risk of dangerously low blood sugar becomes very real. According to the Ozempic label, 24.4% of patients on 1 mg plus a sulfonylurea experienced symptomatic hypoglycemia, with severe cases in about 1%. GLP-1s alone rarely cause low blood sugar, but stacked with these medications, they absolutely can. Anyone also on sulfonylureas should talk to their endocrinologist about reducing or eliminating them. Number 1, alcohol, especially heavy or binge drinking. The number one thing to watch on GLP-1 medications. A 2025 Virginia Tech study found GLP-1 users initially feel less drunk, which can encourage overconsumption. Separately, a 2024 Yale study found GLP-1 medications decrease a liver enzyme called CYP2E1, meaning once alcohol is absorbed, it stays in the bloodstream longer at higher concentrations. Alcohol also suppresses the liver's ability to raise blood sugar, and combined with GLP-1's insulin-boosting effects, hypoglycemia risk jumps significantly. Both alcohol and GLP-1 medications independently carry pancreatitis risk. The rule: keep it moderate, always pair with food, and stay well hydrated. So there it is, 20 things that should never be mixed with GLP-1 or GIP medications. Remember, this isn't meant to scare anyone. These medications are among the most effective tools available for weight loss and metabolic health, but using them safely means understanding how they interact with everything else. It all comes down to balance, awareness, and open communication with a healthcare provider. Drop a comment below, which of these 20 was the biggest surprise? Subscribe for more science-backed GLP-1 content, and we'll see you next time. Stay cool and limitless.